Hey everyone, welcome back to the channel and thanks for your support. Welcome to the third video. In this video, we'll be talking about a few different things. It'll be interesting also to a lot of us. I'll be talking about the two main different exams we can take to get qualified as a dentist in the UK and to be able to register with the GDC after passing or clearing these exams. I'll be talking about the ORE and LDS as the title says. I'll try to compare the dates, the fees, the exam itself, the components, the structure of it, who runs the exams, the difficulty, and what do we get at the end of each exam. So I'll try to go through each step by step and to help you maybe making a decision on what exam you should take to maximize your chances to become a registered dentist in the shortest period of time. So let's start our video. So after watching maybe the first two videos, reading some resources, asking friends, families, and searching, doing your research about the UK, you have come up with the decision that the UK is the best country for your needs to meet your future goals, careers, and for your families to live in. So before we do take this move, we have to prepare ourselves, get paperwork ready, know what really needed, what is waiting for us to allow us to practice dentistry in the UK freely. So the three main routes or ways to be able to practice dentistry freely in the UK are either by clearing the ORE exam or clearing the LDS exam, or by doing a baccalaureate degree or BDS degree in a UK university, which is only one university at the moment doing it, which is the UCLan University or University of Central Lancashire. This university has a specific program made for overseas graduated dentists. They can take this course, which is 1.5 years long, to study again, and then after completion of this program, which is 1.5 years, they'll be able to register with the GDC straight away without taking any exams. I'll be making a new separate video for this specific subject, for this university and the course. So stay tuned, I won't be really talking much about it in this video. In this video, I'll be talking mainly about the ORE, the LDS, the compartments, the different parts, what is ORE, what is the LDS, and each fees of each one of them. So let's start about the ORE. So what is the ORE? ORE is the Overseas Registration Exam. The ORE runs by the GDC, the General Dental Council. This exam consists of two parts, part 1 and part 2. Part 1 is the theory part of the exam. Part 1 normally runs twice a year around April and August time. This exam consists of testing your knowledge, theory of undergraduate studies, of what we studied during our 5 years undergraduate. It consists normally of two papers, paper A and paper B. Paper A covers any clinically applied dental science and any clinically applied human diseases, which means it tests your knowledge on embryology, anatomy, biochemistry, microbiology, so all of this sort of boring subjects, but it has to be done. Paper B, it tests your knowledge on clinical dentistry, law and ethics, health and safety, UK guidelines, BDA advice sheets, so all sort of clinically related subjects. Some parts of it test your knowledge about the NHS. So part 1, so once we get our paper registered with the GDC to be able to sit the exam, the fees of part 1 is now at the moment £806, but it's set to change at the end of this year. So from the 1st of January 2025, it will go down to around 560 something pounds, which is part of the GDC reassessment fees, and they said it's going to change again. So paper A and paper B will be done on a computer-based paper exam. So we'll be sitting on a computer and answering multiple questions, or EMQs, which is extended matching questions. So we match each answer to the question to the right answer. or single best answers. Each paper consists of 200 questions, should be answered within 3 hours. There's no breaks during it. It will be done over 2 days, day 1 for paper A, day 2 for paper B. The exam takes place normally at King's College London, in London at their campus in London Bridge. It's not going to happen online, but maybe in the future they may do this step and take it, just like the Royal College of Surgeons, like the MFPS exam or the LDS. For this exam, the 2 papers, we can study and prepare for it on a self-study base, read some resources, some of the very common books, prepare online courses, attend face-to-face courses. So it's all up to you and to your ability to pass this exam. But it can be done without attending any courses. The 2 main books we can prepare and read to get ourselves ready for the exam is the pink book, which is the Clinical Dentistry, the Handbook Clinical Dentistry by Oxford, and the blue book, which is the Applied Clinical Science, also by Oxford. It's 2 like pocket or handbooks, can be bought. Sometimes there is online versions, and there is hard copies you can find in your local maybe libraries. Reading these is very important, and then reading some of the BDA sheets, some Master in Clinical Dentistry books, radiology, but the main thing in my belief is to try to study previous past questions and get to a question bank where previous questions came, so you get yourself prepared. You know your weakest points, weakest subjects, so you like try to focus on this kind of studies to try to avoid mistakes in the exam. At the moment, I'm working on a very exciting website, which I'll provide a question bank for the ORE Part 1 and hopefully for the LDS, so we can study and revise online without attending any face-to-face courses. Will be very easy to log in, easy to revise and study through. So stay tuned, still on progress, so hopefully it will be ready soon. So the number of seats for ORE Part 1, it used to be 200 seats or places previously, but in this year the GDC decided to maximize the number of seats can be reserved, and at this setting coming in August they maximize it to 600 seats rather than 200, and they may continue to do so for the upcoming settings. We're not quite sure yet, but at the moment it's 600 per setting, and if it's run twice a year, so that's 1,200 places per year, which is a good number, and that gives fair chance for everyone to book the exam. So after clearing the Part 1, your name will be added to the Part 2 candidate list, and you'll be allowed to book the upcoming Part 2 exam. Part 2 normally consists of 4 components. I'll take about each one in more details. Part 2, the fees of it is at the moment £2,929, and it's set to increase at the end of this year to become about £4,235. It may increase further as the GDC mentioned. The Part 2 runs over normally 3 days. Part 2, it's always gonna happen face-to-face as examination. It'll be done at the UCL or Eastman Hospital. The components of the exams will be done in separate days apart from 2. The number of places or seats per exam, it's about 144 places per exam, so no more than that. The number of settings, so the number of time ORE Part 2 normally runs per year, is between 2 to 4 at the moment. Maybe this year, so far they announced about 3. They've done 2 or maybe 4 this year. They may increase it further, like back in 2017 there was 6 exams each year. So that gives us a lot of places and chances to book the exam. So roughly standing around 500, 600 seats per year. So maximize your chances to book the exam. So at the moment, we're still at 144 per sitting. and times 4, as I said, about 600 seats per year. I'm going to talk now about the components of this part 2. I'll start by mentioning the days they do run. So the days of the exams, on the first day, you'll be tested on the first component, which is called OSCEs. OSCEs stands for Objective Structured Clinical Examination. It means that you'll be going to be tested on your communication skills and clinical skills in few different stations and scenarios. So this exam is about 15 to 20 stations, which is like stops. You'll be allowed to read the scenario at the door, and then in the scenario you'll have a question about a patient, about a clinical skill you have to do, or a prescription you have to write, do a dental charting. So you may find in the room an actor. You have to take dental history from them, you have to take medical history, you have to present a treatment planning, give them a diagnosis, manage a clinical situation, manage something with a colleague of yours like needle stick injury. So there are 3 different types of the OSCEs. Actor OSCEs, which is you like perform a task with an actor and there will be an examiner assessing your skills. Skilled OSCEs, which is to test your clinical hand skills like doing suturing, taking dental charting, doing a surveyor. So a lot of different kind of exercises. I'll also talk about it in the different videos. And the third type of the OSCEs is the written OSCEs, which you will answer maybe questions on a paper, write a prescription, do assess like a PPE chart. So all of these will be done on that first day. It takes about 3 hours to finish, and the day will finish for you. The second day of the exam is called Dental Mannequin. Dental Mannequin is to test your hand clinical skills on phantom heads and Frazaco plastic teeth. This exam lasts for 3 hours. It also runs at the UCL, their campus in Rockefeller in London. You'll be given 3 hours to complete roughly about 3 exercises. These exercises varies from crown preps, cavity preparations, performing a filling, building a cusp, taking an impression, doing a temporary crown. So this exam is all about performing tasks in a good health and safety manner, showing them that you are safe to practice. There is no cutting corners. You do the tasks according to their consortium and stick to the main recommended preparation thicknesses, let's say. This part, unfortunately, considered the main component that makes any student fail the whole ORE because of its precision. So you have to be very precise, and the main practice for part 2 is to make sure you're good at your dental mannequin. In day 3, you'll be tested on the 2 components, which is the dental treatment planning and the medical emergencies. Dental treatment planning is something similar to the OSCEs, but on a bigger project, where you have to perform a task with the actor, and this actor you have to take a dental history, medical history, ask for clinical tests like vitality tests, x-rays, models, and assess these artifacts with you, and then perform a diagnosis, a treatment plan, management for the patient, manage their expectations. You have to show this in a very professional way and perform like you're a true actual dentist, not only a student taking the exam. And also there will be examiners in the room with you, like 2 or 3 examiners assessing your skills. This part, it's not so tricky, it can be passed, and as I mentioned, the dental mannequin is the trickiest part. The other component you'll be tested on day 3 is the medical emergencies. Medical emergencies where you have to perform and show them that you can do a CPR, you can do basic life support. There will be 3 examiners in the room asking you few different clinical scenarios of patients having some medical emergencies like hypoglycemic attack, anaphylactic shocks, hypertension. Any kind of medical emergency could face us in dental practices. To know that you can diagnose and know what is going on and how to manage it, how to deliver this specific kind, let's say, of medication for this specific medical emergency. I'll try to put the link for each resources and guidance for the ORE Part 2, so you can read through it if you're interested in the description of the video. For ORE Part 2, you should pass all 4 components to be able to pass the whole ORE exam and be able to register as a dentist. If you fail any part, any component of ORE Part 2, you have to resit the whole exam apart from the medical emergency. If you fail the medical emergency, the GDC will allow you to retake the medical emergency at the next upcoming setting of ORE Part 2, so you only do the medical emergency. The fee of it is £300 at the moment and will increase to 500 something from January. You should clear the medical emergency in the next setting. If you don't clear it, then you have to retake the whole ORE again. You are allowed to re-attempt ORE Part 2 4 times, and you should clear it within 5 years from the first time you attempted the Part 1. So if you failed to pass the Part 1 in the first attempt, this is when your 5-year period starts. So you should clear both parts within 5 years from the first time you attempted the ORE Part 1. ORE Part 1 as well, you have 4 attempts only to clear it. If we fail, unfortunately, we can't retake this exam and we should look to do the LDS. After completion and clearing the Part 1 and the Part 2, you'll be allowed to register with the GDC and have your GDC number to start practicing as a dentist in the UK. So that is the end of the ORE on a brief. I'll try now to jump to LDS exam. So, what is LDS? LDS stands for License in Dental Surgery. It's an exam run by the Royal College of Surgeons. After completion of this exam, you'll be allowed to register with the GDC. LDS consists of 3 parts, Part 1, 2 and 3. Part 1 is similar to ORE Part 1. It tests your theory knowledge about dentistry of undergrad. It also consists of 2 papers, Paper A and Paper B. You should clear both papers to pass this exam, so you should get at least 50% in Paper A and 50% at least in Paper B. If you get 40% in Paper A and 60% in Paper B, that means you failed the exam because you failed Paper A. This exam normally runs once a year, around April time. The maximum number of candidates is 120 per setting. It's done remotely, so you can do it online while you're in your country. You won't have to provide any English evidence when you want to book this exam, so you can take it without showing them evidence of your IELTS or English proficiency. The fees of this exam is around £900 and it's paid when you book the exam. So after clearing Part 1, you'll be allowed to book Part 2, but you have to provide now English proficiency test exams like IELTS to be allowed to book Part 2. Part 2 consists of 2 sections. First section is OSCE, similar to the ORE, and the second section is unseen cases, something similar to the dental treatment planning in ORE Part 2. The OSCEs is 12 stations. Each station is 7 minutes. You read a scenario, you go in the room, perform clinical scenarios and with an actor OSCE. That will be done in the first day. The second day will be the unseen cases, which is similar to dental treatment planning. You will go in the room, take history from the patients, write your findings, and then perform it and deliver it to the patients in a English communication language understandable to them. It's 4 cases, half an hour per case, and that's on the second day. The fees of this exam is £1,575. The maximum number of candidates can book it is 96 students, and it runs normally twice a year, as they said, but can be once a year. So after completion Part 2 of the LDS exam, you'll be allowed to book the next upcoming Part 3 exam. Part 3 is the dental mannequin part. Similar to the ORE, It tests your clinical skills and the hand skills of drilling teeth. It consists of 3 cases, should be done over 3 hours, 180 minutes. Case A and Case B are operative kind of cases where you do restorative kind of work. You prepare a crown, you do a cavity prep, do a filling, cusp build-up, so root canal treatment on a tooth or any sort of clinical tasks, again similar to the ORE. But Case C is the new thing. It was not like presented before, but it's a new thing they introduced to this exam. Case C is, I think, as I heard from a lot of people, it's something like the skilled OSCE. So they may ask you to do 4 to 5 exercises, which could be perform a suture, show them how to use a surveyor, take a BPE, do scaling, tooth extraction. So it's skilled OSCEs, similar to the skilled OSCEs in the ORE Part 2. The fees of this exam is £1,575. Number of seats is only 36 seats per setting, and it only runs once to twice a year, normally only once a year. After completion of all parts and passing part 1, 2 and 3, the LDS will allow you to pay fees to get your certificate, which is 230. You will get a LDS certificate from the Royal College of Surgeons, which you can present to the GDC to get yourself registered and will be a qualified dentist. So the LDS have maybe spread the exam over 3 parts to maybe save the students money. So if you fail the mannequin part, which is the most common part people fail at, you can pay only for this. You can reset the exam the soonest you can. But the downside is the number of students are allowed to take the exam. So if we want to maximize our chances to pass and be able to work as dentists in the UK as soon as we can with more attempts, better and more regulated exams is to take the ORE. However, ORE doesn't give you any certificate upon completion. The LDS, you'll be granted a certificate from the Royal College of Surgeons, which can be presented. You can use it as like sometimes considered as you graduated also from the UK, not only qualified. Each exam has its own pros and cons. Some people try to get both exams done at the same time. Whichever comes first or when they book it, they will go for it. Think about it. At the end of the day, the fees are very close, similar to each other, but the number of sittings per year more on the ORE. The number of candidates can take the exam is more on the ORE, and more resources to study and prepare for the ORE than the LDS. Both exams can get you to the safe shore, so at the end you'll be able to work as a dentist when you complete either. I hope this video was not long. I know I talked a lot about it, but I'll try for the next videos to show you how to fill up the application form for the ORE, so you'll be able to book your first part and then you get through the second part and you finish your journey. If you like this video, please support the channel, subscribe and like, share it with your friends, and stay tuned for further videos, and looking forward to see you soon again. Take care.